According to the 2011 Uganda AIDS Indicator Survey, the prevalence of HIV/AIDS in Uganda stands at 7.3%, which is an increase from 6.4% that Uganda was at for over a decade. The statistics show that the prevalence is more in women.
Was caused by two things. One, the rate of new infections, which was at 140,000 annually, and also the fact that many people on antiretroviral drugs can now live longer.
Several interventions have been put in place over the years to reduce the HIV prevalence in Uganda. One such intervention is the prevention of mother-to-child transmission that was first introduced in the year 2000. In 2012, the Ministry of Health made it mandatory for all pregnant mothers to test for HIV at their first antenatal visit. According to the ministry, this initiative, known as the Elimination of Mother-to-Child Transmission, has helped reduce newborn infections.
In 2009, we had almost 22,000 new infections annually, and that is for children that were being born with HIV. However, this reduced down to 15,000 new infections by the beginning of 2011.
Even as these numbers seem to be going down, the Director General of Health Services, Dr. Ruth Acheng, says a lot still needs to be done.
Only 47% of mothers attend all the 4 antenatal visits.
The First Lady, Janet Museveni, has today launched the Elimination of Mother-to-Child Transmission campaign for the Kampala region at the Kololo airstrip.
We'll fight to protect the child from getting HIV and AIDS in the womb, protecting the mother-to-child transmission, so that we ensure that all children that will be born from now on will be free of HIV and AIDS.
The First Lady, along with other dignitaries, took public HIV tests to encourage the masses to get tested. Janet Museveni, who has been at the forefront of the fight against HIV, says EMTCT is a new miracle drug that is going to help Uganda battle HIV.
That we should have no Ugandan child ever again born with HIV and AIDS.
The fight against HIV in Uganda has largely been supported by international development partners. But there are now fears of a reversal of the gains made following threats of aid cuts by donors over President Museveni's recent enactment of the Anti-Homosexuality Law.
Our partners in development, we must thank them together and ask them to continue holding hands with us in this battle, because we are building a global village.
The chairman of the Uganda AIDS Commission believes it's high time Uganda sets up its own AIDS Trust Fund to continue supporting HIV patients.
When Zimbabwe was boycotted by all the donors, Zimbabwe decided to establish its own National AIDS Trust Fund, with which money they were able to put people on treatment, to finance interventions, regardless of the boycott from the donors.
The chairman's call comes amid more reviews by donors of their support to Uganda. Gertrude Tumusime Uitkware, NTV.